We're here today with Dr. Holly Geyer. She is an internal medicine and addiction medicine specialist. She is also a national speaker on the topic of opioids and addiction, and she's authored over 120 publications. She is the author of the leading patient-focused book, Ending the Crisis, Mayo Clinic's Guide to Opioid Addiction and Safe Opioid Use. Thank you so much for joining us today.
I'm so happy to be here, Kim.
Well, today's topic is really about the most common pathways that lead to addiction. I think so many of us really consider addiction to be just the results of, recreational drug or alcohol use gone wrong, which is why it's got so many ties to moral failure. Could you elaborate on why this is or isn't correct?
I think that's a great question, Kim. The end point of all addiction is essentially this pattern of unhealthy use of substances that really start controlling us as opposed to us having controlling over them. There's quite a few roads, though, that can lead to a person to that state, and I really want to elaborate on those today. The three most common are, number one, chronic exposure to the drug itself. Just repeat activity over and over and over that starts to rewire the brain and then lead to the problems that we see. The next one we see is really pharmacological or medication coping, using it for psychological reasons to help alleviate some deeper pains. And then finally, the one that you alluded to, that pleasure or entertainment pathway.
So what do all these pathways have in common?
The first thing, I've heard this 1,000 times, no one starts off by wanting to become addicted. I'll say that again. No one who ends up on that pathway started off with that as a goal. And in almost every situation, it's usually gradual. It's repeat exposure over time. And most importantly, what they feel at the beginning of their use of pattern, that chasing the high, for many people is very different than why they use it at the end and what they feel and how they deal with their problems.
So the first one you talked about was chronic exposure and how that leads to addiction. Could you go into that in more detail?
So, essentially the chronic exposure pathway is really just repetitive use that ultimately leads to this bodily dependence and all these maladaptive behaviors that come with it that keep that person in the pattern of using the substance. What's interesting about this pathway is that the beginning, the initial use is usually innocent or even comes from a prescriber. An example might be someone who goes out with the guys for a drink on a regular basis on bowling night. He goes out 2-3 times a week, and then it moves over to 5 times a week, and then he's using more and more. It was done with just chronic exposure to the point that one day he finds out that if he doesn't have that drink in his system, that next alcoholic beverage, he goes through withdrawals. He did it for fairly innocent purposes to begin with, but got himself into a problem. Another example might be a provider who prescribes opioids to a patient, and they take them dutifully as prescribed day after day, week after week, month after month. And at some point, those drugs start taking control. They control the thinking patterns and what that person's willing to go through to access them. All of those are great examples of just chronic exposure starting to rewire the brain. The use patterns ultimately develop this tolerance and withdrawal and, like I said, the brain rewiring, and then eventually the body becomes chemically dependent on the drug itself. You need it to function, or so you'll go through those withdrawals. You're going to get cravings if it's not in your system. And fixing the symptoms of this cycle might involve these maladaptive behaviors that we often see in drug addiction and really become what we see as a life-controlling problem.
Well, I know in my personal experience when my sons were really struggling with this is I just could not understand, why they just didn't just stop. And I think this explanation that you just gave started to make more sense to me, that their brains weren't acting right.
You're absolutely right. And we see some pretty big challenges when we try to manage that chronic exposure addiction pathway. One of the first is because of its gradual nature, that day by day, week by week exposure pattern, there's oftentimes very late recognition that that person even has a problem. And then we see all these overlapping features between that chronic pain and addiction pathway, particularly with opioids, because they're hijacking the brain's emotional response system, the memory, the circuitry, the perceived need for the drug. All of those are very prominent in chronic pain syndromes. All of them are very prominent in addiction. And so differentiating those two might be difficult even for the average provider. And then the other issue, we've got these assumptions that because the drug is prescribed, like opioids, you can't develop addiction to it. And the opioid crisis has very much taught us the opposite of that. And then, of course, stigma, other drivers, mental health disorders, personal life problems as being viewed by all other people as the original reason that a person became addicted. That may not be the case, and people are scared to come forward and say, listen, I'm on this drug, I'm getting it prescribed legally, I can't believe I'm addicted because I didn't start off with depression or anxiety or PTSD. I'm just a normal person that took too much med and now it's controlling me. That stigma is a big barrier. I know a lot of people that just have the willpower to just stop, but their body won't comply. The withdrawals, like we talked about, is a barrier. And studies are showing that these populations in particular might be less likely to respond to the psychosocial interventions that we offer in comprehensive treatment, an example being counseling, because these really aren't driven by mental health or social drivers. It's really a biological dependency that turned to addiction. And
so in those cases, finding a way to deal with that or even prevent that might be helpful. You're absolutely right. I would say overall, any chronic exposure to a potential drug of abuse increases the risk of addiction. And so for legal substances like alcohol, know the CDC limits, 15 for men, 8 for women per week. Stay under them. Less is more. And then for the controlled legal substances like opioids, please look for opportunities to minimize use. Find alternatives, especially in acute pain settings. And then if you can avoid transitioning to chronic use, the data shows that overwhelmingly opioids don't work well for chronic pain situations. Find alternatives and work with your provider. Have an open dialogue. And then, of course, for the illicit, illegal substances, meth, cocaine, my goodness, do not start. Yeah, and obviously with those, when it's these drugs like fentanyl these days, sometimes it's in the situation where we're not talking about an overdose, but they take it and it's so powerful, you can see how they can quickly become in an addiction situation. The faster these drugs of abuse make it across that blood-brain barrier, as we say, straight into the mind, the more likely they are to become addicted. And so that's what we're seeing with these synthetic opioids on the street like fentanyl. It doesn't take much to develop this cycle. So let's talk about the pharmacological or medication coping. How does that pathway lead to addiction? So this is a red herring in this grouping we're talking about today. The concept really revolves around using a substance to either escape or replace a negative mood or a negative experience. This is far more prominent in those people with baseline mental health disorders or people with trauma, life stressors, going through an active divorce or losing your kids in a divorce. They're going to be more susceptible to experiencing this. All of these people really have the same kind of drivers where the drugs of abuse alter the brain chemicals through multiple pathways. Serotonin, norepinephrine, dopamine, all these others that are kind of off to begin with because of these stressors, these psychological impacts, and the drugs of abuse just make things worse. We oftentimes group drugs of abuse into different categories. You might have heard of stimulants or sedatives, dissociatives or hallucinogens, and they really depend on what kind of pathway they're impacting and what drug is being used at any one point in time or in combination. But when drugs from these classes are used in people with baseline mental health issues, they can have this powerful temporary alleviation effect of emotional pain or anguish. An example, people with depression can have euphoria or elation. Imagine how good you would feel if for once in your life, right, you're excited about something, you're happy again. People with anxiety can feel calmed, right? It's alleviating that constant sense of fear and anxiety. People with PTSD can be relieved of those bothersome memories. And when you put this all together, what started off as an easy solution ultimately becomes the problem. And that leads to the issue of, this either you describe it as either dual diagnosis or, this co-occurring issues. And, these issues with mental health issues are pretty common with people that are also having issues with addiction. You're absolutely right. The data shows that at least 50%, if not more, of individuals who struggle with substance abuse issues do start off with a history of mental health problems. So it's highly prevalent. And, it begs the question,
if it is alleviating the problem, why not use it, right? If it's offering relief. Like I said, the problem is when the cure becomes the disease. Chemical coping really prevents healing through two mechanisms. The first one, that person using the drug isn't necessarily getting the treatment they need to overcome their driving conditions. Things like counseling and therapy, other helpful medications, and all the social support and spiritual manifestations as needed, legal conditions that need to be addressed aren't getting addressed. And then the second issue is that the drugs in themselves start trapping that person into a new bondage with chemical dependency, and then that's got all of its own set of problems, as you can imagine.
Well, I remember again in my experience with my sons, hearing them say, I can't not have this. I can't not have, almost like it's even taken over the position of air in their life. Like it's even more important than that. I have to have it. So is that what we're talking about? Like a challenge is, how do they deal with this when this pathway in their brain has been rewired?
It's a major challenge, my goodness. And go to the heart of the disease is probably one of the first answers I would give you. We know that this whole chemical coping type pathway requires some hardcore digging. You've got to find that underlying driver. And I don't know if it was applicable in your sons, but anything earlier in life that might have been a trigger for later use is something that you would need to fix. We know there's significant shame for anyone in acknowledging a driving condition, right? Who wants to come out and disclose that they were sexually abused from age 10 to 15, right? Or who wants to tell people, listen, I know I'm a strong man with bench pressing 250 pounds, but I've got depression. It doesn't happen in American society, and it makes people appear or feel like they appear weak and thus avoid getting help. It's something we need to overcome. And then, of course, the treatments that they might need often require incredibly hard work. You're digging deep. You've got to have self-reflection and the time commitments and, honestly, the financial commitments to get to the bottom of all this. And ultimately, there is far less instant gratification with taking these approaches to managing that problem than there is of taking a pill. You can imagine why it's hard.
Yeah, and in my son's case, I know many people, the trauma and the other issues were very prevalent. And in his case, it wasn't really so much that, but he described it as being, he didn't feel good in his own skin. Like the first time he tried something at the age of 15, he felt like a different person. And, he doesn't even really know where that came from. But clearly something, once he started taking that, had an effect on him in a way that made him want to keep having it.
Kim, you've nailed it. The rewiring that occurs in addiction makes that drug become the most important thing in your life as you search for short-term gains at the expense of long-term gains. And that's the nature of addiction. And ultimately, as we go through in our neurobiology section, we talk about why the brain changes over time, over a period of months to years, to really being rewired to avoiding the toxicity of not having the drug in the body as opposed to chasing the high. So I definitely encourage our users to listen to that.
So what prevention strategies can be helpful in this pathway?
I think one of the first things, develop a support network. That's going to be a powerful prevention tool. There's a phrase, the cord of three strands is not easily broken, and I'd say the more you are inter-networked with other people that can help you stand strong when you're feeling at your weakest, that's going to be key. For friends and family, definitely create a non-threatening environment for them to talk and be supportive of them. Be prepared to be that resource that they need when they're in this situation, whether it be financial or navigating them through the treatment process or, even emotional or spiritual support. For all of them, prevention is the best mechanism before you get into the state of addiction. So seek help early. Before you start taking that first drug, get the treatment for your trauma or your depression. It doesn't have to end this way. If you know someone that's susceptible, make sure that you're keeping potential crutches out of the house or supervised use. Don't keep alcohol around if your husband dealt with alcohol problems for 20 years. And limit interactions with the drug community for sure. That's going to be a big driver. And then I, as a provider, would say always keep that primary care provider looped in so they can help and be a resource.
So finally, let's talk about that last pathway, and that's the pleasure or entertainment pathway to addiction. What is the driver here?
It's easy to recognize. We all know what this one looks like because it's probably the most common one we see in people, friends, family, loved ones, or on TV. But it's essentially just what it looks like. Use or experimentation of drugs of abuse just for entertainment or pleasure. I would say it's the most common reason people think that someone becomes addicted, which is why it's easy to negate the other two we've talked about. But make sure that you're not forgetting about those, because if you don't deal with some of the other underlying driver issues, that person may not reach recovery. I would say that this is also that pathway that most people consider the whole world of addiction to be viewed as a moral failure or as sin, because you're making bad choices that lead to bad outcomes, so fix them, right? It's not that easy. I would say it's probably the most common pathway for teens and young adults, and it can happen both with drug-related and non-drug-related addictions, pornography, gambling. When we think about addiction, though, as a mechanism for the pathway development, it's really similar to the chronic exposure pathway in that what starts off as fun and recreational and enticing behavior over time leads to something you no longer control. There's a couple other unique features, though. Unlike the chronic exposure pathway, people are using these drugs for pleasurable experiences. Many people who start off using opioids and become addicted over time do not experience that euphoric surge, that happiness chemical. It's just changes in the way the brain rewires. In this entertainment pathway, they're chasing the high. And people, particularly with drugs of abuse, recognize that the more powerful initial euphoria they experience, the more likely they are to repeat that activity and then move on to more and more powerful drugs, as we call chasing the high. I would say it's important to understand there are certain genetics that influence the degree of a high a person can experience. When I take an opioid, I throw up. I've had patients that take it and beg for more within 15 minutes. A lot of this is biology.
So what are some of the challenges in managing that pleasure entertainment pathway?
First of all, I got to recognize addictive substances are everywhere, and this makes them harder than we could possibly think to avoid or safe-proof our family members from. We know that experimentation is common, especially in young adults, and the drugs in this era are far less forgiving than the ones that you and I, not to date ourselves, had to deal with previously. Fentanyl is a menace in society. One pill can kill is the DEA's marketing campaign right now. We know that the high that they get with one drug usually extinguishes due to bodily compensation, and then over time, that can lead to experimentation with more powerful or hardcore drugs, like you'd move from cannabis or tobacco over to methamphetamine. And because these brain changes are there to compensate for the high levels of dopamine, everyday pleasurable activities, you're walking your dog or eating ice cream, bring very little satisfaction or happiness. And then that further just drives pursuit of the drug in order to experience those emotions.
So what about this crossover between, drug and non-drug addiction?
We know there is a fair amount of crossover between drug and non-drug addiction, and we're still learning more. There's a lot of people who enter sobriety for one drug only to find that they face challenges with others, like overeating or moving to tobacco or other less hardcore drugs of abuse, but still those that could become that. And so I would say that the lifestyle of that pleasure entertainment pathway can be really costly to the average person who gets into it. They can lose their reputation, John's an alcoholic, or John drinks too much, or John's the partier. That can live with you for a while. It can certainly impact your vocation or your ability to hold a job. Relationships get broken down, not uncommonly. You can get long-term stigma from this. And then, of course, the financial costs with using some of these drugs or maintaining the behaviors can be tough.
So let's talk about the prevention strategies and what can be helpful in this particular pathway.
I would say, first and most importantly, talk to your loved ones about the risks of drug use or overuse of legal substances, and show them the data. It's all over the internet. I don't know about you, Kip, but the Montana Meth Project is something I've been a big fan of. It's these campaigns that have gone on in Montana to really change prevention strategies across the state. And there are these hard-hitting, kind of graphic television and print and social media platform ad campaigns. I encourage our viewers to go online and just take a look at some of these ads on YouTube. They don't sugarcoat the topic, and that's one of the things we need to stop doing. We need to be hardcore and very vocal about the potential costs of long-term addiction and how short-term addiction can lead to it so easily. Another thing I would say is set boundaries in your house early. Make sure your kids know or your family members know what activities you will and will not tolerate, what does and doesn't lead to addiction as a warning sign, and where you're going to draw the line as a family member. Develop consequences and hold to them. Another thing, we've talked about this, but social circles are key. Make sure that you're limiting negative influencers and help them create new ones. If you are a faith-based family, get them into a church, right? If you have community support activities, do those. And then build a repertoire of healthy alternatives in your family. Have a family game night or take family vacations. There's a lot of stuff to do out there that's not drug-related. Give them alternatives.
And so from that prevention conversation, one of the questions that comes up all the time is, what, I really did try to do all of those things. And I think, clearly everything you just mentioned, these are standards. These are things you should do. But in the end, it's not a guarantee.
Kim, you're 100% right. What we've talked about here are the most common pathways to get to a bad destination. And as much as we try and prevent all sorts of issues in our world, we know that there are consequences that we just can't prevent. And I think in some of our other sections, we're going to go into tremendous detail what to do if and when your best efforts haven't been successful. There are options and there are ways out of this.
So any final words?
I would tell our audience, addiction comes from many backgrounds and it can look like a whole lot of things and it responds to treatment differently. It can come with varying degrees of relapse. What doesn't change in the condition is that this person is trapped. They are trapped and they want support. They need support, even if they don't vocalize that. So the loved ones that surround that person are a critical part of the recovery process. Stay involved.
Yeah, I just remember distinctly, again, dealing with this as a family. And once my son went down this road and got so far into it, he would just make, the comment that it's like, I want to stop. I don't want to do this, but I just can't. And I think it was really eye-opening to understand how powerful, this became. And so I am so thankful that eventually, he was able to move forward from that and to get the help that he needed. But it was a journey. And it sounds like these three things, just to recap them, are that these many roads, one destination. Chronic exposure, pharmacological or medication coping, and then this pleasure entertainment. And again, they all have one thing in common, and that is
the medications hijack, the brain rewires. It's all about the cycle of addiction, and virtually everyone who ends up in this state needs the same type of treatment pathways to get out.
Thank you so much.